Genotype testing in code simply means the processes involved in testing for that defective gene, which is the hemoglobin S. We have AA hemoglobin, then we have the AC, SC, and the rest. There are so many hemoglobin that the electrophoresis can be able to dictate. Errors that can be detected, that's in the process of running genotype now. Like in the laboratory, we have analytical error, pre-analytical error, and then the post-analytical error. So sometimes you discover that whenever there's an error, or an error can occur at the point of collection, that's even in the reception too. When there is a mislabeling, that's labeling of samples or the containers, you can have an error there. Or maybe collecting a sample of someone that is not supposed to, or you're not supposed to run the genotype for him, and then you collect it and then you run. Sometimes the analytical errors have to do with the machine now itself or your reagent. If your reagent starts deteriorating, or maybe it has started losing its potency, definitely it will not give a good result. You may have a false positive result. Someone may be AA, and then you now discover that the machine is reading AS, or maybe it's even giving you SS result or AC result. So in that, to correct that, you have to involve the use of a professional to handle those diagnostics services. To me, it may be as a result of the first person, or maybe the person that ran the first test for them. Maybe there may be a mix-up somewhere, but genotype doesn't flip. To me, yeah, faith works, but basically we can't say that it changes. It doesn't. So to me, anybody or anywhere you actually define, or you feel that yes, they told you that this is your genotype, and then you go to another diagnosis center, they give you another result, then there may be something happening. Maybe the electrophoresis may be faulty, or maybe your reagent, or the way and manner in which you actually preserve your reagent, that's the buffer salt too, may be faulty. Sometimes you discover that the salt itself, maybe how do you preserve it, or how do you save it? Because sometimes it's not everybody that takes it as in his or her time to know the right thing for him to do or for her to do. Some are just working in a laboratory just because they just find themselves there, and some are not trained personnel that are there to handle it. I know of a situation whereby some people, there are some other diagnostic center, not to call names, sometimes they'll look at you and then they'll just say, okay, you are so and so, and which is not supposed to be. The right thing needs to be done, which is collecting the sample of a patient, following the due processes, and then running the test and giving out whatever your electrophoresis or whatever your machine tells you. You have to give it out. And in running it, you have to use your controls too. You don't just run a genotype test just like that. No, you have to use your controls in checking and knowing, yes, your test is being tested and then the right thing is being given out. A scientist, or will I say a hematologist, is still a scientist. When they said you are a hematologist, that means you deal with blood. That's hematology itself, is the study of blood and all other blood disorders. So as a scientist, you will have different disciplines for one to become a scientist. That means you must have to have a knowledge on medical microbiology, hematology itself, virology, chemical pathology, histopathology, and the rest. Yeah, it's not funny though. Some people will come with the expectation, yes, this is what they've known before, telling them, yeah, they are AA. And lo and behold, when you run the test, you will discover that they are not AA. Some are AS. And sometimes for them to accept it, it's difficult sometimes. So the only thing you do is that, since you know what you've done and you know, yes, your controls have passed, because as I said earlier on, before running a test, you have to make sure your control pass. In every investigation you carried out in the lab, you have to do it with your own control. You have to do quality control. Check the reagent and make sure, yes, it's valid before running any diagnosis. So if you know that yes, actually you've done that, and then you know that yes, your result, you can boldly beat your chest and tell them yes, you can go to wherever you are, go to any good hospital to run it. Because one thing with laboratory results are, as long as it's your own blood or your own sample that have been taken to run a test or run an investigation, definitely it will definitely give the same result. So you can boldly beat your chest and tell them they can go to wherever they want to go, and then that result will still be the same. If you're running full blood count, or let me say blood count, total blood count for a patient now, it helps in the diagnosis of patient, because as we all know, sickle cell have to do with the hemoglobin, and hemoglobin, as we all know, is what is the oxygen carrying capacity of that same, or will I say, of an individual. So you now running a total blood count for a patient, it helps to analyze other parameters that has to do with that patient. For you to like run a total blood count for a patient, one, there are so many parameters that are involved, which we have the main corpuscular hemoglobin, the main cell hemoglobin, the main what they call it, PCV, which is the packed cell volume. We have the hemoglobin itself. We have the total WBC count, which is total white blood cell count, and which we have still the neutrophils, basophils, and the rest. So for you to do that, it helps you, it gives an indication of yes, this is what is wrong with the patient, and from there you can pick up and then know what do I need to like do for that particular patient. So it gives a direction on how the patient is actually feeling. Okay, like in a hospital setting, so what we do is that you as a medical lab scientist, you only run what the doctor actually wants you to do. Because you can't just decide for the patient, okay, this is it. Even peradventure, you actually see something, you indicate it on your laboratory request form, or will I say your lab report sheet. For any investigation that the patient comes to run, it must be from the doctor or the clinician. So it's the work of a clinician now to be able to work, to convince the patient and tell him, yes, this is what you need to do. You as a laboratorian, you only do what the clinician wants you to do. That is the investigation that he may want you to actually run. So it's left for the clinician now to help the patient know the reason. Your own is just to do the work. In that regards, though I've not come across such, that's for a patient to be, let's say, okay, you've been tested severally to tell you, okay, yes, I'm AA, that's both the two parents, and then you gave birth to a sickle cell patient. For me, I've not come across such, so I can't say anything regarding that. But in as much as they gave birth to a sickle cell, then definitely there must be something wrong in the aspect of the diagnosis. As I said earlier on, PCV simply means packed cell volume. So if the PCV of someone is down, most especially, as I said, sickle cell patients, their PCV are always low. So for you now to know, yes, your PCV is low, definitely you can't just sit back at home and just say, yeah, my PCV is low. No, you have to go to the hospital, and a diagnosis need to be run on you. And so many times, if your PCV is low, yes, definitely you will feel some weakness in your system. Those are some of the signs and symptoms, but you can't just feel, okay, because I'm weak, you just believe that yes, your PCV is low without carrying out an investigation to yes, this is it, my PCV is low. Or no, you can't just sit back at home and just know. And like I said, the normal PCV range, that's for an adult, a normal of an adult, that's for male, it ranges from 35 or 37 to 50, though it depends on the geographical distribution. And then for a woman, it can be at the range of 35 to 45 or 47, still depending on the geographical distribution of that. So having a PCV, I know of some cases whereby you discover that some people are even having a PCV of lesser than 15, 9, and the rest, and which is what? They are anemic. So for you to discover that, definitely you see that for a sickle cell patient, you discover that that person, that hemoglobin that we are talking about, takes blood, oxygen around the body, and then that person will find it difficult for him to like cooperate with that.